There's Margaret.
Hi, Margaret, again.
All right, let me go ahead. And I think 1, 2, 3, 4, 5, 6. We have
No, we're 5.
5. We need.
We're 5 out of 10.
Where's Gabriel?
I don't know. He's and I don't have Becky. I'm looking for them. I don't have Jason. So maybe wait a minute.
Mm-hmm.
Yeah,
Okay.
I don't have Becky. Jason.
Let's give a
I
couple
see
more
Gabriel.
minutes.
Okay, I see Gabriel. Let me bring him in. Okay, here's Gabriel, and I'm looking for Becky and Jason. No Jason, no Becky. Okay, so you have 6 out of 10.
All right. Well, let me go ahead and
I got Mehran. Okay.
good enough. All right. All right. So a few important reminders. This meeting is open to the public via the web or over the phone. Board members will appear on the screen while the public attendees will be on audio. Everyone is normally muted except when given the floor to speak. All members of the public may provide comment to the board on each item and during general public comment. When an agenda item is up, the board president will ask for public comment. Please use the computer controls. We've already gone through these once before. So if you should have any questions at this time, please raise your hand. Okay, we're going to go ahead and proceed. Lori, would you do roll call, please?
David Lasher. Absent. Brandy Grace.
Here.
Becky Levesque.
Here.
Okay.
Thank you, Becky.
Hassan Mamarian.
Here.
Great. Moran.
Here.
Jason Hector. I don't hear Jason. Okay. Gabriel.
Here.
Great. Thank you. Assad.
Here.
Myself, you're here. And David Balin.
Here.
Great. We have a quorum.
At this time, I'm going to, we have a presentation from the CAG. So I'm going to go ahead and ask, I'm going to promote Craig as a panelist. Let's see. Oh, there's Jason Hector right there. One moment. Would you please call Jason Hector one more time? Lori?
Jason Hector.
Present.
Thank you, Jason. I found you in there. All right. Let's go ahead and bring Craig in as a panelist. Okay. Craig, do we need anybody else as a panelist? Craig Galante?
Unmute yourself, please.
I was muted as you were transitioning me to panelists. Other potential panelists would be Andrew, Brian, Mary Blair, and Dr. Nordella, because he'll be addressing scientific issues.
Which other two would you like at this time?
Nordella and Andrew, please.
Okay, promote Andrew. Andrew is panelist, and Dr. Nordella was, I just saw him a second ago. Did you bring him in? Oh, there
No,
he is. I got him.
Got him. Okay.
And Assad, screen share when you're ready, please.
A moment.
Okay. Permission granted.
Thank you. Yeah, David, whenever you're ready, your meeting.
No, you've got, this is your platform, Craig. Please proceed
Okay.
whenever you're ready.
Oh, well, thank you. Thank you very much, David, and the entire PRNC board. We've got a full house. I'm very grateful that you guys are, stepping up on this very important topic. So this was a presentation was designed specifically for this special meeting, and I will be moving quickly because we have a lot of ground to cover. So the agenda will be a review of what we just heard about, and we'll talk about some key issues and concerns that the CAG has. We will also reinforce how the CAG and the community has been very clear on what the health study should be. And you heard that in comments from the community and as well as board members. Finally, you'll hear about this no confidence issue, but we're going to offer very specific reasons why there are concerns. And finally, we want very much for this to be a Q&A. This is an outstanding opportunity for the board to get the insights that they need to help protect the stakeholders they represent. So key issues, jump right into it. The overall, the goals and priorities is vastly too generalized, and there's often some very misleading language in there. There's also significant gaps that are missing in the document itself. And you did hear it from the community. There's no required clinical examinations. There's no required long-term evaluations. It's not described as a longitudinal study. There's no requirements for evaluation of the chronic exposure that preceded the blowout that we've been exposed to for decades, as well as the acute of the blowout, and then the subsequent chronic once again. There's also, because this is a newer realization, there's no requirement for radiation evaluations because they found polonium-210 up there, and nothing has been done to evaluate what's happening. And also the particulate matter exposures, which can be very harmful. That there's nothing in there about that exposure. What is also of great concern is the goals and priorities document really encourages using proxies or estimates of chemical exposure. You take a small sample, and as Brandy and other computer scientists know, you try and throw it into a model and do an extrapolation or an estimate. And they're really encouraging that. And that's not consistent. You'll see it. That's not consistent with the community's wishes. So not only is it missing a lot of things, conversely, the document does make very specific demands that it must include susceptible populations. So they're not adverse to putting in requirements, but boy, they sure missed the big ones. So let's jump in and talk about our issues. A misleading comment. Because what you heard tonight on the surface sounded actually pretty good, right? I mean, if you were a novice, unaware of the situation, you would think that the goals and priorities was very far encompassing. And it is, but it's probably too far. The devil is in when you read the language. And I want to make sure that the board understands and the community that's present. They make a claim, how did the SOC create the goals and priorities document? To understand what the residents really want. They claim, you even heard it tonight, and it's in this document, first red underlined, significant feedback has been received from the CAG. So we have provided considerable feedback. The question is, was it listened to and applied? Now, this document says that the SOC got information from all of these bullet points, a virtual town hall. We're not aware of any of them that attended that town hall by DPH. As a SOC member, other than Dr. Nordella, attended any one of your neighborhood council meetings? I've been to every one of your meetings, and I know all the SOC members, so that's not a true statement. And regular email communications, they don't exist on a regular basis with the SOC. So yet they claim in the document, the SOC uses information to shape their goals and priorities. Here's another really concerning statement, and I want to read it to you a little bit here. Because a range of health symptoms, including irritations of the eyes, nose, throat, nausea, abdominal discomfort, migraines, dizziness, all the things that many of us either had or know of people that did have, nosebleeds, shortness of breath, skin rashes, and other mucous membrane irritations. Here's the key point I want to make. Most of which were consistent with and attributed to low-level exposure to natural gas odorants. This is not a true statement because the odorants, like mercaptan, the thing that we smell, do not explain these symptoms. And you don't take it from me. We have Dr. Rodella, and if you could unmute him, he can expound on this. If you're talking, doctor, we don't hear you.
Yeah, I'm here.
There we go.
Okay.
So the captain.
Yeah, I mean, these symptoms that are all listed above are a lot of the same symptoms that I found when we did clinical evaluations, phase 1 and phase 2. But to rely on one small chemical that's low level to cause these is very much an inaccurate scientific kind of assumption. You were exposed to multiple toxins at unknown levels. That would probably be more of the issue of covering this sort of symptomatology. So, you know, there's ways that they can still look for it today. Give you an example. They could go and look again for fugitive admissions. They could go and do particulate matter evaluation. They could go and do toxic crude oil thumbprinting to find out exactly what is coming out of those wells. But I don't see any mention of such, so I'll stop there.
Thank you, doctor. So here's another untruth. So after in the document, it says after the well was sealed, outdoor air contaminants returned to background levels. That's not true, because after the leak was sealed, benzene levels were found to be well above background levels in the community. They were also levels higher than Cal EPA considers toxic. How do we know this? DPH commissioned a study that demonstrated this. So DPH's own information contradicts what they put in the goals and priorities. Here's the data. At one point in the Highlands, benzene level was 13. This was done between March and September of 16. And in 21 of the 40 samples that detected benzene, these levels were above 2.2 on average, which is typically above ambient background levels in Los Angeles. So that was an untrue statement. And remember, so for reference, Cal EPA says 1 part per billion, not 17 or 13, excuse me, not 13. 1 part per billion is considered toxic. Okay, missing language in the goals and priorities. There's no requirement for physical examinations. You have to be very careful when you read this, because they use the phrase could include, not must include. Could include is not limited to physical and mental health. Another one, clinical studies are not required. Clinical, physical, virtually the same thing. Study types may consist of clinical studies, no requirement. So there are claims that are made that they listen to the community. Well, the #1 demand in the community has always been clinical exams of the people, not an environmental risk assessment of the chemicals they suspect were in the air. To facilitate this estimate of what was in the air, the goals and priority drafts really encourages using proxies. And that might be an unusual word for many folks, but proxies are, we're going to use a bit of data and then extrapolate up to what it potentially could have been. Not what it really was, but potentially what it could have been. And they're giving a carte blanche scope to let the researchers use proxy measures to make estimates. Again, this is not what we're asking for. So for example, these predictions of ambient air pollutant concentrations have been used to study effects of pollutants on an array of health outcomes, including impacts to cardiovascular, respiratory, neurological health, as well as cancer risks and overall mortality. This statement I really want you to penetrate for you. Odors have been used as proxy measures for ambient pollution exposures. So if we read this right, they are giving great latitude to the future researcher to use smells, odors that are recognized in the community as some way to make a proxy or an estimate of what we were exposed to. Is that what we want? It's not what we've been telling them we want. So That's a pretty dangerous assumption to be making. So again, I want to stress how they're not, DPHs in the draft of this goals and priorities is not without one restriction or one requirement, and that is it must include susceptible groups. So they're not adverse to using a language that requires something, but they've only done it, it's the only place they did it, was on that it must include older adults, children, newborn, pregnant women, homeless and low income, minority groups, workers, and people with pre-existing conditions. I don't know if we're going to argue about that, but they made that one stipulation when there's so many more meaty things that are necessary for this study to do what the community wants. So those are a handful of our key issues from what the document represents today. So again, claims were made that they really listened to the community and they were all passed along, et cetera. But the CAG and the community have been very clear on what they want in health study. So back in July of 2020, the CAG presented to the SOC members, and here's what we said. The community needs answers to the following. What are the near and long-term human and pet health impacts and risks to the community surrounding Aliso? We also wanted answered, what are the synergistic toxicity health impacts of this unprecedented exposure of unique combination, duration, and quantities, and this is hard, of unknown and known chemicals and substances. So we want to know answers to not only what we were exposed to, but what are the effects of these combinations of things. And then finally, that before, during, and after study needs to include chronic, acute, and then chronic exposures once again. Okay, am I going too fast? No, very good. Okay, thank you. So also in that same meeting, and again, this was back in July. This is early when the SOC were together. This was our really first chance to provide to them what the community wanted. We made it abundantly clear that it must be a clinical-based, patient-centric study. We even use the phrase gold standard, which is well understood in the research world, of a long-term study, that it examines the people for both near and long-term health concerns. We also articulated and used very specific examples of prior DPH studies that relied on environmental health risk assessments. And we said, don't go down this path because they're non-conclusive, because they're based on estimates of only the known chemicals that were in the air, estimates of what was in the air. We don't know a lot of the chemicals because they haven't sequestered them or subpoenaed them from the gas company. In addition, CCST, that's the California Council for Science and Technology, who, by the way, did a presentation to the PRNC back, I think, in 16 or early 17. And this is where I got this information. They deemed that the air monitoring measures were flawed and unusable for a true health assessment. Now, were those intentional? It wasn't, the CCST had nothing to do with it. But who did those measurements was SoCalGas. So were they intentionally mismanaged? We'll never know. But the net of it is the independent technical group that advises Sacramento has made it very clear you can't rely on these measurements for, I'll give you just two reasons. They weren't up and running at the very early stages of the blowout when the most harmful chemicals were coming out. This is the CCST words, not mine. And they also were very critical of how the gas company set the threshold 20 times higher than the toxic level. So like benzene, it's at 1, they set it at 20. So it could have been, benzene could have been 10, 15, all day long, right next to the monitor, but it never triggered to measure. So CSST has said you can't use it to evaluate environmental health assessment. Yet, if you read the document and what we've been intuitively knowing, the CAG is known because DPH speaks in these terms, is they appear to be on the same health assessment path that leads to non-conclusive results. And these studies that they've done in the past conclude with more research is necessary. That's not what we want. So we laid this out to the SOC, right? We made it abundantly clear what the community has been telling the CAG members what they want. So along the way, we're in discussions with DPH. We're not really talking to the SOC. We identified that there are fundamental health study issues that need to be resolved for this health study to be complete and in the vein that the community has advised us they want. And there's a long list here. Many of you have seen this before, but well, I think I should rephrase that. A few of you have seen this before, but many of you have not. So this is in months of delay. All right, the air monitoring has been approved, funded, but we're in month 29. This is all updated for April. I just updated it today for April. The chemical list, that's 19 months in delay. The CAG has been together for 20. We put the chemical exposure list on there, and I think at our second meeting, if not the first meeting. The CBC study, Dr. Nordella, as you know, did a CBC study, and it showed that there's chronic benzene exposure to the community. We asked for a follow-up. That's 17 months in delay. Fugitive admissions, they're ongoing. What's in them? Again, 17 months delay. Let's move on to some more of the health study kind of stuff. Cancer registry study, 12 months in delay. These evidence bins. There was evidence bins stored at the conclusion of the blowout, and there's 31 of these bins that were pulled off site in 2016. They were likely pulled off site because they were the worst of the worst from the blowout, and they needed to go get incinerated because they're toxic chemicals. We have asked repeatedly that this information be subpoenaed or requested or forced from those that know, and it has not been materialized. Here is more evidence of what could tell us what we've been exposed to. Okay, so you could argue the chemical list, and we'll get into it, that it's with another group. I'll show you how DPH can respond to that, but there's other things here that don't get so litigious that are not being done. Okay, we'll give them a attaboy and girl for delivering on the community survey results. It only took 4 months, and that was just published last week. So these things are going on, right? And the CAG is starting to get anxious because we're very concerned. Again, we made it abundantly clear what the community wanted. Here's an excerpt from an email that the CAG sent to the SOC and copied all of the right people on DPH, including the leadership and everybody associated with the study. The CAG encourages the SOC to ensure that they have full disclosure of all information, including chemical lists, et cetera, so that they may discuss and reach a consensus on the type of study to be undertaken, right? Because, as Brandy said, garbage in, garbage out. So if you don't have it, you can't make good decisions. So it's the unanimous desire of the CAG and the overwhelming desire of the community that this be a patient-based study driven by a long-term evaluation and monitor a sufficient number, which is typically called a cohort, of the affected community members, so that you can evaluate the indices of acute and chronic health hazard or disease associated with proximity to Aliso canyons, periodic, excessive, and chronic low levels exposures of petrochemicals in a manner that becomes a scientific gold standard referenced for future generations. So I realize I'm being a little long-winded, but the net of it is, this is what the CAG and understanding what the community's wants are, we articulated in early November. Then on November 30th, because DPH told us the SOC is going to be delivering their goals and priorities in days. That's what they told us back in late November. So we sent another letter saying that we're very concerned that the SOC is moving towards goals and priorities without the chemicals and substance exposures, inaccurate historical air monitoring. You guys can read this. I don't need to go through every one of them, but there's no evaluation of the radiation, the activity that was discovered. The CBC insights weren't back yet. There was not even an accurate cancer surveillance. So there was these huge gaping holes of data that we felt were very important that be understood before a goals and priorities list was put together. SOC input. So we are left with whatever DPH is telling us or what's in the document. But in reality, and luckily we have Dr. Nordella, who is a SOC member, and I'd like for him to chime in on this. But the CAG is completely unaware of what scientific discussions were had by the SOC to rationalize how they came to the conclusions and the goals and priorities. And I also want to stress that we have made no less than 4 requests to have such a meeting before the CAG have such a meeting with the SOC before the goals and priorities was drafted. We needed to be able to answer your guys' questions of, whatever you want. So there's no minutes, there's no notes. And Chris, who did a great job of presenting that document, told us in our last CAG meeting that DPH wrote the goals and priorities document, that actually Chris wrote them. She might have gotten some input from the SOC, but it's drafted by DPH. That's not how they're positioning the goals and priorities document. We had a liaison, Dr. Nordella, to help us keep informed of how the conversations were going with the SOC, but that transparency is gone. So maybe Dr. Nordella can tell us of his time there. How were these issues addressed and spoken about?
Well, from the beginning to the end, it was all basically just general conversation. So they'd pick a topic and discuss it and say, well, how about this or how about that? And that's exactly what you're seeing today. When I look at this, what impressed me about the document, aside from it being well overbroad, is that it did not specifically address anything. It's, I hate to say it's a Christmas list that is for a millionaire on a poor person's budget. You're not going to be able to afford any of this. And I have no idea on how they're going to take and extrapolate the information and put it into an RFP. It was all kind of hidden to us as SOC members. So very general conversations, no specifics. Everything was done on surveys. No surveys were shared with each other. And I had to fight to get the email addresses for our fellow SOC members so we could communicate. So yeah, it's just, unfortunately, it's a controlled environment. I think it's with intent. And I think it's something that the board should know and the community should know.
Thanks, Dr. Nordella. Isam brought up a really good point. He asked if the SOC would be reviewing the RFPs. We asked that very early on in the process. The SOC will not even see the RFP. They will not be participants in the evaluation of who gets the research. And that was very concerning to us. They said there was legal issues and the DPH was the only ones that could do it. Okay, moving on. So what should be required in the goals and priorities? And let's go over them and see if you guys agree. So to have a complete and accurate health study, it requires that DPH go and acquire and provide the critical information that the researchers lack any legal standing, right? They don't have legal. University of Michigan or University of Colorado has no legal standing to go compel SoCalGas to disclose proprietary information. DPH does. The county does have legal standing and statutes in which to go after that. So to do this right, these informations should be provided. Composition of the gas, liquids, and solids expelled from the blowout. It's not just the gases. It's the crude oil, the liquid. It's a particular matter that got in our lungs, created the Aliso cough. The crude oil is highly toxic. But then also the ongoing or operationally used chemicals and quantities. The 31 missing toxin bits, evidence. And finally, the goals and priorities and eventual RFP, right, request for a proposal, must contain language that provides the community what they've asked for. It should be more accurate in representing the Aliso Canyon disaster. I showed you some misleading statements. There's more. It should require clinical evaluations of the physical and mental health of the people. And it should be requiring that there be a long-term evaluation of the residents that represent the gold standard of such studies. In short, the study must or require that it be focused on clinical evaluations of the people. That language does not exist in the document. So that's the document. That's what we're going to say about the document tonight. Now I'd like to go over briefly why the community and the CAG don't have confidence in the current path. and the reasons why. Okay, are we good? Everybody good? Nod your head. Yeah, excellent. Thank you. So what started off to be a way to measure confidence that the CAG had with the path of the study, and I want to make this crystal clear. We were frustrated because things weren't moving in a direction, or that long list of delays. So we created a scorecard to measure our confidence with the intention of, if you improve on the deliverable of the things that we see are fundamentally outstanding, confidence will increase, community buy-in will increase. Our ability to advise the community would be positive rather than negative. But what happened over time is things actually got worse from a CAG's perspective, and we continued to lose confidence in the path the study was on. Again, it was intended to improve, not to do something negative. So, history lesson, very quickly, we've heard all these things before. We inherited as a CAG a significant mistrust in the community. And it started with Dr. Rangan's letter to healthcare providers that don't look for toxicology while people show up to the ER, et cetera. Acrolein was found in 96% of the homes. It is a known number 2 most harmful element that comes out of underground gas storage facilities, as noted by CCST. What did DPH tell us? Oh, don't worry about it, it's cooking oils. That's usually where it comes from. These were in unoccupied homes in 5 or 6 classrooms, 5 of 6 classrooms. As Mary Blair, who's been a principal for a long time, will tell you, there's not much deep frying going on in that classroom. Benzene. We inherited that DPH made a false claim about in-home benzene testing, that they were negative. It was not, their statement was untrue. They never tested the dust in the homes, and UCLA had just told them they found it. And benzene was found over the limits in the air, so it wasn't true. Crude oil, this one, guys, please, just make sure you're aware of this. And this is what was so troubling. DPH denied knowledge the community was exposed to crude oil in 2019. Yet in 2015, during the blowout, they advised the board of supervisors that crude oil was being dispersed over the community. So understandably, there's deep mistrust. Without trust, the community feedback indicates that they're not going to participate in the study. So that's what we inherited, and it was a hot mess. We tried, and we met with DPH leadership and offered them multiple paths to gain the community's confidence. And I think of the 12 that we offered, only 1 or 2 were supported. Okay, with this significant mistrust in the community, we started assembling ourselves as a CAG and started creating pillars. What do we do to get the confidence and to get this study pointed in the right direction? And we came up with 3 very simple pillars: that the study and the path there be community-centric, that it be science-based, and that we push the political agenda or influence out of it. Now, it's very hard to do the last one, but that's where you get a true study, right? If you can get the political agendas out, the community will have trust, they'll have a wide participation, and then most importantly, when the final study comes out, they'll have confidence in its findings if you appeal to these 3 pillars. As time went on, this is a little redundant, but the top concerns of the CAG, and I've brought this to the Porter Ranch Neighborhood Council in the past, it really hasn't changed. The chemical list, the evidence bins, the radiation, they found radiation up there, but they've done nothing to look at what's in the community. CBC study, Dr. Nordella found evidence of chronic benzene exposure. These fugitive emissions, remember the fugitive fire? What's the origin of that, of those methanes and toxins that were burning up there, coming up from the ground? The field is leaking today, and there's been no mitigation or clear identification of what those toxins are. What most recently has happened is the DPH made unilateral decisions that really minimize the CAG and the community's voices. And this should be very concerning. He also removed 2 critical community advocating SOC members. Dr. Nordell is one of them, and Dr. Christopher Sistrunk from the City of Hope is another. We'll get into that in a minute. So here we are, we're waiting for these. This is what's given us pause. And then we get hit with a club on early February when we have our last CAG meeting, and unilateral decisions are made. They never asked the CAG's opinion, but these are the policies that DPH implemented. They chose to put junior staff in very critical roles. They're very nice people. You met a couple of them tonight. They are nice people. They just do not have the gravitas of experience for, and they're well educated, but they don't have the gravitas of experience to take on the topic of this magnitude. And I don't think these are the individuals that you would think are in charge of the face of the community, as well as who's overseeing the SOC. Again, they're nice people. It's nothing against them. It's the choice of DPH's leadership to bring these people in an early meeting with Barbara Ferrer and probably the top 3 people at DPH. Barbara Ferrer, who you see on TV all the time, the chief medical officer, and the chief science officer. The CAG met with them because we were getting nowhere with staff. And we pitched, and they agreed to bring in the NIH to help guide this study. They agreed to it. It never materialized. So unilateral decision number 2, reduce the CAG's meetings from monthly to quarterly, 67% marginalization, and what little transparency existed just evaporated. The CAG subcommittees, which were doing good work, was eliminated and brought back within DPH. And if you're this far behind, why do you bring more work back inside? So they really silenced us. And there were some really critical subcommittees going on. Cancer research, CBC, community outreach, the opinions and needs survey, a video message that's going to be passed on to the researchers to see the face of the community. We were silenced, guys. I want to address this carefully, but I just do want to make sure that the PRNC understands the ramifications of potentially unexpected consequences. DPH, when they were describing how they're minimizing the CAG meetings to quarterly, they rationalized it. Dr. Davis said at the head of the meeting that we're reducing the CAG's meetings because we have new communication channels via the NCs. So that's what they use as the rationalization. They were specifically referring to Porter Ranch Neighborhood Council. And the reason why we know this is because we've talked to other neighborhood councils, and none of them have been approached other than Porter Ranch. Now, what I'll just assume was not an intent to undermine anything or anyone is being misused by the Department of Public Health saying, we have the voice of the community through the NCs. Well, it's you guys that are claiming they have that. And I'm not sure you want that role or accept that role or portray that as your role. You guys, of course, you want to protect your stakeholders. But in doing so, that rationalization minimizes the CAG's effectiveness to advise all Valley NCs, right? It's like we can go, we didn't get the right answer from mom, so we're going to go to dad. Not a good alignment. And the CAG just wants to make sure that all NC members and residents have full access to CAG members. If they feel we're not being a proper voice or we're not including issues you have, we're ready to listen to you anytime. Another policy change that is very harmful to the community is DPH removed 2 SOC members that have been nothing but strong advocates for the community. Dr. Nordella, who you all know very well, he was the only practicing clinician. So if you could do a health study, don't you need some clinicians on board to understand what you're looking at rather than an air monitoring PhD? He was unanimously elected by the CAG to be a SOC member, and DPH didn't put him on there. They didn't want him on there, but we unanimously elected him on there, and he was removed. I mentioned Dr. Sistrunk a moment ago, and this guy was great. This guy comes from the City of Hope. It runs in the best of the best circles of global research and health issues. And he was a member of the SOC. At our meeting where they did all these things, where they really reduced our role, this is what he said. I think he just made it very, very succinct. There's too much to say and not enough time. He had to leave to go to another meeting. The bottom line, this is a tragedy on a tragedy. Why is there no real concern for the lack of confidence in this process? Why is there a sense of doubling down on staying the course that is clearly not transparent? This is shameful. It's truly shameful. This is a guy that lives in the research community of the best of the best. A few weeks later, Dr. Sistrunk was gone. We lost our two strongest community advocates from the SOC. Not a good look. So is this community centricity in your mind? We've been significantly and unilaterally censored. And this has been done by your Department of Public Health, the ones that are supposed to protect us. So you have to ask yourselves, is this the right path for the study? Let's talk about science. And I'm going to wrap it up quickly. I realize I'm going a little long. DPH and the county have unique legal latitude to go subpoena this information. They can even pierce the trade secrets. For those that are really interested, here's the safety code. So they have the legal wherewithal, they lack the political will. They can do this at any time. The punchline is, for the sake of the public's health, we need to know what we were exposed to. So if you're sitting in front of your oncologist or your immune suppression physician, it would be really good to know what you were exposed to so you can have an informed discussion about your healthcare. But not only that, it's needed for the eventual researchers. So this information is long, long overdue and critically required. Since we got a no from DPH about subpoena, we didn't just sit in our hands. I'm not going to spend any time on this. The CAG banged on every door that we could with the elected. Barger, Councilman Lee. We spearheaded 7 NCs to unanimously vote that the county go get the subpoena data. And we want to compliment the PRNC. You guys wrote a brilliant letter. Where are more of those letters? That was a brilliant letter. And we even got a petition going with 2,500 signatures that went straight to Barger. We did not sit in our hands. So big runaround. Not only would DPH deny they had such authority, we had to demonstrate to them that legally they did. And then they finally came back to us and said, we're not going to use our subpoena authority. And when we asked the very simple question you all have in your minds, why? They simply told us, can't tell you, attorney-client privilege. That was unacceptable to us. So we keep pushing. And the latest comment we're getting from DPH is, you guys spoke to Catherine Barger, and we are deferring to the supervisor's office to use subpoena authority to get this information. Deferring. So now look what happened, folks. So obtaining the chemical list is no longer science driven. It is now political. And you think of our pillars: community centricity, science-based, and push the political agenda out. The chemical list violates all three. What really can get, well, I'm going to say it, what can really get you upset is, and this is a screen grab from the Department of Public Health's Environmental Health Division. This is the group that Chris and Christina and Charlene are in. And this is their mission statement. By identifying, preventing, and controlling harmful environmental factors in Los Angeles County. Then it further goes on to say their mission is to educate the public on sources of environmental risk so that they are empowered to protect themselves, their families, and their communities. Chemical list, CBC, cancer registry, evidence bins, radiation testing. Where is the protection? Where is the information? Okay, you've heard, I'm wrapping up, guys. I know you're getting the answer. You've heard that the CAG lacks confidence in the path that it's currently on. I want to show you something that just bear with me. Let me do this setup really quick here. You heard about the telephone interviews that DPH talked about just a moment ago. Chris explained there was 400 people in a telephone interview, and then there was an online survey of 346. Right. So together, that's nearly 750 people that offered opinion. In the interviews, in the telephone interviews, surprisingly, 32% or 128 of the people they spoke to on the phone were totally unaware of the blowout. Okay. I'm not saying it's bad to talk to people who are unaware, but I want to put that on the spectrum of awareness level. So they had no awareness of the blowout or the actions by DPH. Conversely, let's go to the other end. The CAG, the CAG is immersed, right? We've been doing this for 20 months. We not only know the issues, know the facts, but we're immersed and can monitor the actions and inactions by DPH. Fair? And then everybody else falls in between. Those at the interview that were aware, the online survey, which Lori, Hassan, thank you so much. Almost 350 people responded because of PRNC's outreach. Thank you. Okay. And then 2 adjacent NCs have voted on confidence, Granada Hills North and Chatsworth. So they are also adjacent to Aliso Canyon. And then of course the CAG. So you want to see the results in confidence? No, you don't want to see the scores? Okay. So here's how it goes. With very little awareness or no awareness of the blowout, not so bad. You know, only 34% of the people are not confident in DPH. But as you move along the awareness spectrum, confidence drops off significantly. It's been 5.5 years since the blowout. I'm going to wrap it up. CAG's been at it for 20 months. Yet the current path the study is on, it's not following science, it's not following the community, or the absence of policy, of politics. Is that what we really want? Last slide. Our request of the partner, Puerto Rico Neighborhood Council, is to partner with you. And Assad had many very good comments about what to put in a write-up. He made some suggestions of grouping multiple people's comments together. We'd love to partner with you on observations and background and histories. Maybe we can collaborate on a joint document. I think you guys really, for the community's sake, need to insist on everything that we've been saying, that the study be a long-term, patient-centric clinical studies. We invite you to clarify the role of the CAG and how we do represent you. We ask that you take a hard look and maybe make a tough choice. You can issue a no confidence vote. Doesn't mean you're firing DPH, right? It's just saying right now, from what we know, we don't have confidence, and you have an opportunity to fix that. Thanks for all your attendance. Thanks for having this meeting. We appreciate it. You're one of the more involved neighborhood councils. And of course, when we get into Q&A, we'd love to talk about what else the CAG can do for the PRNC. Thank you for letting me speak so long. I hope I covered good information for you. I'll turn it back over to you, David.
Thank you, Craig. Great presentation. And I know that we already have hands, so don't go too far. Becky, you had your hand up first. Would you please unmute?
Okay, here I am. Couple questions, but I'm just going to state the questions. But first question is, Mr. Galante, you said that Porter Ranch Neighborhood Council was contacted and that we were the only neighborhood council contacted. Was the entire neighborhood council contacted, or was it individuals? That's question number one. Question number two is kind of directed to Dr. Nordella. I was wondering, have there been any numbers that have come out regarding the mortality rate of people in the affected area? How many people have died as a result of it? Do we have any of those numbers? The third question is, were there any effects on the platelets? Platelets count, does it show up in the blood work? And the last question is, have there been any studies on epiglottitis or the epiglottis, that part of the respiratory system? Those are my questions.
Shall I begin? And then, because the first one is simple, and then I give the rest of the doctor. So, Becky, how the conversation with PRNC took place, I honestly don't know exactly how that flowed. I know that there was some discussion about air monitoring, but the point is DPH is using it as an excuse for minimizing or lessening the frequency of CAG meetings. And I don't think that was the intent of the conversations around air monitoring. And then I'll let go ahead.
Yeah, so the first question I think was mortality, the overall mortality of the community. Nothing has been looked at. And the problem is this has also been an issue with the cancer. And, you know, certainly not meaning to be offensive, but more so just factual, is that it's hard to get at, not only because people aren't looking at it. The other issue is that the attorneys have kind of semi-gagged some of the community members, which was a big frustration with myself at the beginning of this. They have data that can be reviewed and come up with the answers. The second thing I think you talked about is the platelets. The platelets are part of the CBC study. It comes from the same stem cell as a red blood cell or white blood cell. And yes, they were affected in the data review that I did over 10 years. And there's other studies that parallel the same findings, but it was done in actually a pediatric population, which I thought was very interesting and had the opposite effects. The third question, and I'm so sorry, what was that again? Oh,
Becky, you're muted. Thank you,
Were there
Becky.
any, am I muted or not?
You're
you are
good now.
not now.
You're good.
Okay, great. Were there any studies on the effects on the epiglottis? And when you also talked about the platelet, what about sticky platelets? Any studies on that in reference to the blowout and the chemicals that were released? So the question you asked me about was epiglottitis.
So to go to epiglottitis really quick, first of all, epiglottitis, the diagnosis is just inflammation of the epiglottis, which is the small little piece of tissue that protects the trachea every time you swallow. So
Right.
It just means that it's inflamed.
Mhm.
And inflammation is swelling, and you could do a diagnosis through pathology and a biopsy and so forth and so on. Most epiglottitis is bacterial infections. But again, you're in the airway. So anything that can chemically harm the airway from the nose all the way down to the bronchus and the alveoli, you're at risk for. So that's why people for a long time don't recommend going into a closed space, shaking 2 cleansers in the toilet, standing over it and scrub it and breathing it, because you get damage to the mucous membranes throughout from nose on down. So bacterial epiglottitis is a whole different issue. So there are no studies to address your question. There's no studies, but there's no studies on anything in this community. I mean, I just want you to really understand that there has been no studies, and even the Casper study, which I understand they call a study, isn't a study. It's a survey, and it's a survey done by Department of Public Health through really non-medical people. These were door knockers. And the door knockers would say, you know, do you have, let's say, cough, cold, congestion? Are you spitting up blood? Are you whatever? They did the questionnaires and took back, and then took the questionnaires and laid out the symptomatology and said that the community was complaining of this. None of those patients that I am aware of were ever seen and examined by a physician from the Department of Public Health. Now, by their private doctors, most likely. But that's just to stay. And now back to the platelet issue. Sticky platelets are an issue, of a microscopic kind of morphology diagnosis, on and on and on. None has been done. No studies have been done in this community. What we looked at is just the quantity of platelets. Was it as a mean compared to controls? Was it up or low or elevated? And that's what we looked at along with the CBC. But the thing that was very impressive about the CBC that you all should know is that there were numerous parameters: white blood cells, lymphocytes, RBCs, hemoglobins, hematocrits, and platelets. 6 parameters were absolutely on a non-statistical, statistically significant difference as control groups. So mine wasn't to draw a conclusion. Mine was just to basically state the fact and saying, we need more data. So hence Quest Diagnostics. And hence when I met with Dr. Paul Simon, he agreed with it. And as Craig has pointed out, it's been 17 months and we still don't have the data.
Becky, you're muted.
I keep getting muted for some reason. What about seizures?
Yeah.
Like mini seizures, repeated hiccups, things like that? Any kind of reports? That's it.
Well, again, no reports on anything, but very interesting as I've been invited to step into the Pacoima issue. That seems to be an issue in that community. I haven't been able to do any evaluation on anything yet, but this has been told to me as a heads up.
Okay. Thank you very much.
You're welcome.
You're muted, David.
I know. Craig,
Okay.
I'd like you, this is your platform. I'm giving you your time, but I'd like you to encourage the questions to really be based on the draft health study, if that helps. But other than that, I mean, it's your time. You can answer whatever you want.
Yeah.
So
Thank
we'll go ahead and move forward on this. Assad, I think you had a question.
Yes. Thank you, Craig. Thank you, Dr. Nardella. So we have the draft and we have a lot of gaps in it. And I know when I talk to you and other CAG members, you are in the process of answering individually and you're going to compile a draft, a final one comment. Now, you and Mehran are our elected CAG members. When do you think we could see at least a draft or the direction where you're heading, so that this way our comments as board members are in line with your comments and we make a stronger statement? And actually, if it's up to the board, if we could have even along the line a one combined statement is fine, or at least if we agree on the skeleton of the items. I know we talked, it's lacking a lot of the list items. It's lacking the failed 6 or 7 well attempts. We don't know what went in the air even through those. And I talked, you heard me talk earlier about resilience in the community, how it's going to be affecting and all that. So once you could share with us any skeleton or which direction, which answers, where we're heading, and at least share with us this PowerPoint. This way we can, as a board, give the same message you are giving. Thank you.
Yeah, I think that's a great idea. I mean, I heard many good ideas that I didn't think of. So I think there's an opportunity to collaborate, and I'll talk to the CAG, and I think we'll do it any way you guys want. I like the idea of sharing key points. And I absolutely intend to email this PowerPoint to everybody immediately after this meeting on the PRNC or community members that want it. And we've got 10 days here. It's due next Friday. So from a timing perspective, we will try really hard to put together our bullet points. We've already started, the CAG has, and we'll push to have it by the end of this week. So you guys have the weekend to feed us back some information. With the intent of getting something out by the deadline of the 16th. If we need more time, I think we should lobby DPH for more time, because this is probably the 2 most critical groups, PRNC and the CAG.
Thank you.
Thank you very much.
Does that work for you, David?
Perfectly. Lori, please. And thank you.
Hi, thank you for being here, Dr. Nardella and Craig and everyone. The presentation was amazing. Going back to, this is a question for Dr. Nardella. Going back to the draft, if I understand they probably haven't even come up with a scope of work was what I was expecting to see in this draft. My question is there a statistically significant sample size that if it addressed specific health issues would be acceptable to you? I understand there's more than 8,000 people that were just relocated, and if the sample had to be of those people that stayed here continuously, or, would it include people that were relocated and so on? Is that a fair question?
Yeah, the methodology on a study like that would be very interesting. If I had my way in a Christmas list, I would say I would love to have been able to look at the community at the time, but even now is fine. But of the people who stayed are going to have more exposure. So if you're going to discover something, you're going to see it in those that have been continually exposed, chronically prior to the blowout, then the acute exposure, and then again. And one thing I do want to reiterate is what they talked about before. There is data from the studies, from the GIS-HEAL study, which we fought very hard to get from DPH. I filed a Public Records Request Act to get it. And in that, I read it very carefully. There is an admission that there is ongoing fugitive admissions. And most importantly, this was the time that the field was discharged, was not under the extreme pressures that it is today. So, and it makes the statement is that further studies are needed, but yet no studies are, being undertaken. So the point is that I worry for you as in the community that you chronically got exposed, you acutely got exposed, and now you're chronically getting exposed again. And why they can't run meters in the area very quickly just to show that. The second point I want to make with it, just as, and it's a little tangent, but I think it's important for you all to know, is that they used methane as what they call a tracer molecule. So they made this assumption that, look, if my methane level is this, I'm not going to measure benzene, but my speculation, scientific speculation, because there's a linear relationship with this, is that it's got to be this. So if methane is here, then benzene has to be here. And what they came up with is, you saw the table, which I've tried to make the point numerous times to the researchers, is that there is no relationship, no linear relationship between methane and benzene. You cannot look at methane and say you're all safe and everyone is okay. And I think, again, it comes down to is like, look at, I have nothing to grind against the Department of Public Health except for the fact of the injustice of it. I'm not here to try and be a nightmare for them. I love science. I want the data. I want to be able to look at this, and if it comes up and it says this community is absolutely A-OK and the proper studies have been done, then fantastic. You, I'm sure, would love to know that. Everybody would love to know that. But if there's something that is harming you and it's ongoing, don't you have the right to know?
I guess, just to continue, I guess my concern is that with the amount of money, you mentioned that, it's going to be an expensive study. So with the amount of money that's we're allowed, is there a specific statistically significant sample size of the area of the group that would make a difference? If we had to test only a small number, what is that number? Is there one?
And that's difficult. If I had my way, I would like at least, to randomize, 1,500 patients from a community of 30,000 and compare that to an equal sample size of unexposed patients. Mm-hmm. And I think that would get us at least in the ballpark. And if we had suspicions it would be a probe, then what you do is you extend it. Mm-hmm. And that's how science works. So we can come to a scientific conclusion. Yeah.
Thank you.
I think that would be good.
Mm-hmm.
All right, let's try and move on. Thank you. Thank you both. Gabriel, please unmute yourself.
Yes, sir. Thank you. Thank you to CAG and everybody on CAG for the presentation. I just want to say, based on what I just heard and compared to the presentation made by DPH, I have no confidence in the current path of the health study and the way it's been going. And I believe the PRNC for stakeholders should definitely consider moving a motion of no confidence at our next meeting to get facts, information available to us, because currently it seems like we're just going in circles, and I've lost complete confidence in DPH based on the two presentations. It's obvious who did more homework and who did not. Just a comment.
Thank you for your comment. Jason, please unmute yourself.
Hello, Craig, good job on the presentation. I think that right now, the best approach for the neighborhood council would be, I believe this is under the domain of the safety committee. So I think the best thing for the CAG would be to send specific points, like Assad was saying, on the semantics. This is a semantics issue, right? We're talking about using the word, should or may versus using the word must. And I think that those words are important. Words matter. And I would recommend the CAG specifically address those specific semantic issues and comments on the language of this document to make it more not as broad, more specific, and your main points are good points, patient-centric, etc. So I think I'll just comment on our own internal procedures. I think that it's better I think the proper way would be for the safety committee to call a special meeting and wait for the CAG to formulate specific bullet points. So if you could just simply translate some of your main points into 5 to 10 main points on the language and send it to Assad. He's the chair of safety. Safety committee holds a special meeting. And then once that meeting, if something is approved or recommended to go to the board, then it's at the discretion of the president, Mr. Balin, to set a full board special meeting. But I think that we should ask for more time on this. I think the neighborhood council does need more time. I think other neighborhood councils haven't put it on the agenda, and it would be important to allow at least another 30 to 45 days for Porter Ranch Neighborhood Council could take the leadership role on this, and others could follow should they wish. So, there's no reason we've waited this long. There's no reason. This is probably the most important part of this whole. Well, maybe not the most important, but it's a very important part. So that's the path that I see for this. I don't really think that it would be individual board members submitting comments. I think that would just become, by the time it gets to the board, we want to have something that's really close to being ready to approve. So it needs to be vetted through the committee. And so that's what I would recommend. But thank you for all the work that you've done, Craig, and Miran and everyone else. So I appreciate it. Presentation.
Thank you, Jason.
Thanks, Jason. Very much appreciate it. I want to let you know that first letter that we sent to the SOC was written by your father, like 90% of it. So there's a lot of CAG members that are contributing significantly. I like everything you said. I would just add one caveat, and I think we shouldn't wait for one to deliver something than the other. If it's okay with David and the rest of the board, I'd like to collaborate on the bullet points just ongoing so that maybe we meld together the various opinions so that we can move more quickly rather than waiting for one to finish before the other starts. If that's okay with you guys.
Brandy, please lower your hand, ask your question.
Okay. Speaking not just as a PRNC board member, but also as a concerned mother, I want to start by thanking you, Craig, and Dr. Nardella, Miran, and all the rest of CAG's very hardworking advocates. All of you are doing the frankly very stressful work of continuing to fight for our community and ensuring we have a voice in this process. And many NCs, including ours, appointed CAG members. We got two. We got Craig and Miran. We took a vote and said, these are the people we want representing us in this matter. So I am absolutely incensed at the idea of DPH ignoring our appointed CAG members It's called a community advisory group for a reason. NCs are supposed to amplify our community's voice, not be a focus of smothering it. But as infuriating as that is, I am far more upset that our community's requests for legal action to obtain the chemical list are being flat out ignored. And that is something we all need to continue being very vocal about. That alone, to me, is a good reason to demand more time for public comments. And we need to reach out to our community to get as many people in the public as possible to demand that we get those subpoenas submitted, that we get that chemical list. Thank you.
Thank you, Brandy.
Hassan?
I apologize. David, may I make a quick comment?
Yeah, of course.
Great, thank you. So
That's Andrew, by the way.
Yeah, everyone, yeah, thank you. Andrew, CAG member. So Christina Vega is still on, and Sarah Katz, both representing DPH, are still on this meeting. So, you know, board members, if you want to specifically make requests for more time, I just want you to know there are DPH members on the call. They cannot make the decision, but please, you know, make that request, because we are getting down to the end here.
I request more time.
Thank you.
Can I
Thank you.
address Brandy's one point that Brandy made?
Dr. Nadello, go ahead.
Yeah. So Brandy, I think the most important thing is that if we're not getting the chemical list, to have a study that is really going to yield something, I think that's the most important thing, is to go after the patients. You have to look at organ systems. And you're saying basically that, look, we don't know the chemicals. Do we have any damage in the human body? So to do air monitoring or to do other issues, aside from really focusing, which I don't think they're going to have enough money to do that with 25 million, and hopefully they'll get a grant and that will support it. But you have to look at the patients. They have to look at you. So I just wanted to add that to your point.
I agree 100%. Thank you, Dr. Nardello.
Thank you, Brandy. Thank you, Dr. Nadello. Hassan, please lower your hand. Mute yourself.
Yes, thank you. So a lot of good points have been already mentioned by all of my colleagues, and comments from also CAG members. So I'm not going to repeat those. What I would say is thank you, Craig, and the CAG members for being persistent and bringing information to the board, to the community, so we can together decide what would be the best course of action for this research study. You know, having sat here, all of us, for the last couple of hours or more, listening to DPH and the report from CAG, you know, unfortunately, I can't say we are very close in agreeing or being in agreement of how this thing should move forward. Unfortunately, we seem to be still far apart after so many years of discussions and, you know, whatever situation have been going. I personally would like to see this done properly, and I'd like to see a little bit of closeness of the two groups, specifically DPH and CAG, to be working together more closely, and of course with PRNC. We are not here against each other. I think we all trying to get to the same common goal. There seems to be some degree of animosity and distrust, which is quite clear and understandable. But to get to that end results that we all wish to get for, if we are truthful in what we are saying, I think we need to work more closely. Therefore, personally, I would suggest, and hopefully others are on the board will agree, we cannot push this to say, here is a deadline and we have to scramble to get this. You know, what is a big deal about next Friday deadline? Extend it for a week or two, let everybody's input and the safety committee and all the discussion to take place, and then introduce hopefully a good proposal or a good draft to go forward. So with that, thank you so much, everyone, especially the CAG members. And I hope we can work together with DPH to really bring a good conclusion to this, because our community is really looking to us to guide this process. And if we did not do a good job, I think, we are not doing them and ourselves a favor. Thank you.
Thanks, Hassan. David, let me just respond to that.
Please go ahead.
Thank you, David. Hassan, I completely agree with the sentiment that it would be most productive if all the groups worked collaboratively and with the absolute goal of the health and safety of the community. I want to tell you, without hesitation, I can say in my heart and in my mind, this CAG has done everything that it could to get the attention of DPH to reroute this river. And I will advise this, because you guys elected me as your advisor as part of the CAG, right? And I can tell you that the path that this is on is not consistent with what the community has demanded and wants. I am not in favor of the path that they're on. And Hassan, I just spent the last 45 minutes demonstrating to the entire Porter Ranch Neighborhood Council how it's been the wishes of this community have been abundantly and very clearly explained to DPH and SOC members. So to have then DPH to push us away does not create an environment of collaboration that you and I would both wish for. So we've been doing this for 20 months, sir. They pushed us away. Thank you.
Thank you, Craig. Don't want to run out of time because I really want to take on everybody here. Miran, please.
First of all, thank you, David, for agreeing to put this meeting. I want also to thank Greg on this comprehensive and productive presentation. I want to repeat that we need two important things, and we do have two great doctors that help us through all this process. The chemical list is critical, and the cancer study is critical. It's a must in order for this study to move forward. We really need more time to respond so we can have a strenuous efforts and a better collaboration. The DPH objective draft 2 or 3 till we get it right. And I want to thank each of the CAG members that we are really working very hard, non-stop. This is not an easy task, but always wish us the best and show your support. Thank you.
Thank you, Miran. Matt Pacuco, would you please unmute yourself? Thank you for joining us this evening.
Actually, it's Kyoko that wants to speak.
Oh, even better. Thank you. Kyoko, good evening.
Hey, this is Kyoko Hibino. Thank you for so much, for everyone to do this presentation. As you all know, that I've been fighting, trying to find out if there is a long-term effect, in 6 years.
Going on 6 years.
6 years or more, since 2014 actually. And I was diagnosed with aggressive type cancer in November, and my cat is diagnosed with cancer and have a seizure. So for me, the health study doesn't really mean much anymore, since I already have the chronic impact of living here for 14 years. And so-called gas even said that, the facility emits substance causing cancer. So I have the answer, this is all creating long-term impact in the body. So if the health study doesn't really have any data of all chemical components list and the impact of those chemicals in the body, and the easy health study or the health study that DPH trying to do is really will hurt us, or really hurt communities actually in the world by the community living by the gas facilities. So I'm really afraid that will happen, because it's if once easy studies out, people will keep using it. There's no impact. And that's not true. I mean, I know that. I mean, I live in here and I have a, living proof. And so, please, like, work to get that chemical list. If they can't, we can really have a health study, period. We can have that health study with a chemical component. And, I don't know what kind of, I mean, I didn't get any phone call or any, like, study invite or anything about cancer study. I mean, I don't know what, they will do, but, if they want to study my body, I'm here. So it's just, it's just very frustrated, but I just, we have to get this health study right. Otherwise we can't have this at all.
Yeah, so the health study, like she said, is going to be referred to by the world going forward. So this is not a Porter Ranch problem anymore. It's much bigger than us.
Thank you, Kyoko. Thank you, Matt. Mary Blair, would you unmute yourself, please? Guess not. Okay. She's gone. Okay. Brian Allen, please unmute yourself.
Again, thank you very much for taking this comment. I want to try to add to what Craig said in response to Hassan's comments. I believe Hassan is absolutely right. The responsibility that we had was to work very closely with DPH. We all recognize that, but I was a basic newcomer to this when we started the CAG. And I know Andrew and Craig can both tell you that they had no idea where I was going to fall in this situation, because I was very open-minded. I explained that I wanted to give them a chance, to give DPH a chance, that I thought this is the public health organization. They are there for the reason of protecting us, of watching out for our health. And I was considered, a watch and see, I think. And I promoted that idea. I promoted it with the idea of a partnership. We were to work in partnership with DPH. And we went to DPH. We talked, as Craig mentioned earlier, a few of us talked with the top at DPH, the people that are supposed to be the leaders. And we all agreed, we're in this as a partnership. That partnership never materialized. We tried and tried and tried, but that partnership never materialized. Not because we weren't willing, but because DPH just never allowed it to happen. And the proof of that, it was their undoing, is the fact that they, as you heard earlier again, they shut us down for all intents and purposes. The only thing we have going is a quarterly meeting with DPH, and many have talked about those meetings that the DPH calls CAG meetings. They are not CAG meetings. They are DPH meetings with CAG, but they are not CAG meetings. So with all due respect, I appreciate what Hassan was saying. I believe that his heart's in the right direction and he's accurate in what he is asking to be done. But unfortunately, what you wouldn't know unless you were on the line with us is that we tried. We tried very hard, and we are very frustrated that we were unable to get them to agree to be partners with us. Thank you.
Thank you, Brian. Andrew Crown, would you unmute yourself, please?
Sure, Brian, as he likes to do, stole most of my thunder, but that's okay, because he speaks more eloquently than I. I want to echo a little bit of the same thing. And this is not because, and for those who know me well, I hope, this is not about me trying to prop up a group that I'm working with, a la the CAG. I want you to know from my heart of hearts, with a little bit of contextual background, just how hard we have been working for you and the stakeholders of not just Porter Ranch, but of the entire San Fernando Valley, the people who have no idea that they need to be concerned about this issue. Because after 6 years, I know better, and a number of CAG members know better, just like the board knows better, because you've been involved in this. We have, I know that some people think, the CAG's role is, we're just there to yell and scream at DPH. I want to give you the other side of that. And that is, we are at the point of yelling and screaming because for almost 20 months, it has been us begging for partnership, begging for collaboration, providing, as Craig says, a pathway to confidence, a pathway to partnership on, 20 or 30 occasions. Here's a roadblock. If you go left, this will start chipping away at the issues that the community is having. I can tell you unequivocally that there was only one time when DPH decided to go the route of trying to rebuild. DPH is on the path they want to be on. And I need my board, as a stakeholder, my board to really understand that in your heart. Their actions are purposeful. Their presentations are purposeful. These are smart people. So when the CAG, we come and we say, when we lay out, look at all of the things we have attempted to do. Look at all the information we're trying to get, because we've been hearing from you, we've been hearing from stakeholders across the valley that this is what they want in this health study and this is what they find important. We are beating ourselves against the wall and failing at every turn because the partners, the people that we wanted to partner with, don't give a hoot. And that's why our mini town hall series is a year late, because we didn't want to go that route, hoping and hoping and hoping that we could be more collaborative with public health and really truly get to the study the community wants. And it just never happened. And my parting point very quickly is this. I've been fighting this fight for 6 years. I've been a CAG member for 20 months. As sure as you are sitting here listening to me ramble on, I have never in my life heard a stakeholder ask for an environmental risk assessment. Never. It is unanimously, we need to look at the people. And the CAG has said that to DPH no less than 100 times. And you saw the goals and priority document they thought was worthy of you commenting on, which basically was devoid of looking at the people. I want you to take that away tonight and think about that fact. Thank you.
Thank you, Andrew. So before we've already run out of time, but I'm not going to do that. I'm going to take Mary, Lori, Helen, and Matt, and we will conclude this meeting. Mary, would you came back. Thank you for joining us again. Please unmute yourself.
Okay. Thank you, David. And thank you, PRNC board. I want to echo what Craig and Andrew and everybody else has said, but I really want to point out to all of you on the board something that is very significant and quite frankly angered me. And I'm a reasonable person. I'm was a very reasonable principal with the meeting tonight. And I want to use DPH's words that Christina Vega used, or Vasilik used, about extensive engagement with the community. You already know that as CAG members, many of us were on different subcommittees. Myself, Patty, Lori, I think Ron was on that. We were on the communication sort of outreach committee. And so we have an absolute window into how the Department of Public Health tried to outreach to the community. And I will tell you that it was an absolute failure. And myself as a community member and member of CAG, we were frustrated endlessly, and we met weekly. So when the virtual town hall was put, so that was listed on the presentation tonight as a way that there was extensive engagement. So that virtual town hall had, close to 100 attendees. About 3/4 of the people attending were DPH personnel, CAG members, and also the company that we asked to have manage that meeting. So probably 25, 26 people from the community attended that meeting. I ask you, was that extensive engagement? So the last slide that was presented tonight, when DPH is doing media outreach for the goals and priorities statement, we were told directly in the community, outreach group, members of CAG, we were told directly they could not do Facebook posts, they could not do Zoom meetings, they cannot do that, and by directly I mean DPH cannot do this. We asked for those things for the virtual town hall. We asked for, can you advertise on Nextdoor? Can you advertise on Facebook? And we walked them through how to do Facebook posts. And yet, for the goals and priorities, all of a sudden, all of that can be done by DPH. Imagine how frustrating that is as a community member when we fought and fought as CAG members to say, engage the community in these ways. We had meetings weekly. I even still have it in my calendar because I calendared it out for a year. And all of a sudden DPH can do this. It is an absolute lie and mistruth. And I am very angry because what was presented tonight, you need to know that absolutely was a total mistruth and deceitfulness by one of our public agencies. So when you ask about path to no confidence, okay, no, I don't have any confidence in this health study because as CAG members and Andrew, we were lied to and lied to and lied to. And to say and to tell community members and tell you as a board that there was extensive engagement, there was not. And if there was extensive engagement, it was because CAG worked and worked and worked to get the word out to people. It was not done by DPH. So you need to know that. And thank you for listening. And thank you for all your hard work.
Thank you very much. Very enlightening. I appreciate the comment. Thank you so much. Lori, please unmute yourself.
Hello, everyone. Can you hear me?
Yes.
I did want to first of all, thank you so much to the PRNC for hosting this meeting. I'm hoping that we can have another one and get more of the community to attend. I think a lot of the community members have given up just out of disgust at nothing being done and their concerns not being heard. First of all, I do want to clarify something about what Brian said. The CAG was also silenced in what are now only bi-quarterly meetings. We can't even speak in those meetings until the end when it comes to question and comment time, unless they open up an occasional comment on something that they've covered. So we do not have a voice in there. And I also would like to echo Mary's anger and dismay because I was a member of the town hall subcommittee where it took 6 months to get a flyer out of DPH. I was a member of the cancer surveillance study subcommittee, which I'm going to speak about next. And I was also a member of the, can't remember the other subcommittee. Anyway, yeah, we've been banging our heads against the wall. And in terms of what Mary said for community outreach, yeah, we begged them, get a Nextdoor account, do Facebook posts, do this, do that. None of it was done. So just to clarify that. So I did want to speak just for a moment about the cancer surveillance study. At our last CAG meeting a couple weeks ago, it was brought up that DPH claimed that the CAG dropped the ball on the USC CAG cancer surveillance study, which we had a subcommittee for. Dr. Simon with DPH didn't even know that all our subcommittees had been summarily disbanded. So that made them look a little bit foolish. So our concerns were that the control group for any surveillance study that we wanted done, the parameter was all of LA County, which is also exposed to oil and gas chemicals. Also, I don't know if any of you are aware of this, but if there is a surveillance study done by USC CAG that gets all the data from all of the state, there's a lag time. So my neighbor across the street who's dying from leukemia would not be included. My neighbor, one door up from them, whose son died of skin cancer, wouldn't be included. His mother, who's dying of cancer, wouldn't be included. My sister-in-law, who last week, who lives near CSUN, was diagnosed with multiple myeloma, would not be included. All the teachers, anybody who works outside the area or who moved away since the blowout would not be included in that cancer surveillance study. So anybody who worked in the area, including those 6 teachers that were my daughter's teachers at Castle Bay, wouldn't be included. So just wanted you guys to be aware of a few other things that are going on behind the scenes. So thank you for letting me speak.
Lori, thank you so much for the wonderful insight, things I didn't even realize either. So thank you. Helen, would you please unmute yourself?
I want to thank everybody who commented, and especially Mary, because I have seen it firsthand myself, everything that Mary said. And CAG has been in place for like almost 20 months, but some of us, a group of us, have been involved with Department of Health from the first few months of this blowout. We had weekly phone call meetings with Department of Health for months. Then it became bi-weekly, then it became monthly. So this thing has been going on for a long time. And for last 5.5, almost 6 years, we kept asking questions. We never got any answers. They do not just answers, and this is the biggest insult. That just tells me they're not sincere. They do not want to do the right thing. They just want to do a check mark and just go ahead. And as Mary said, they claim they have been extensively engaged with the community. I mean, come on. How many people have they spoken in community? How many people even attend PRNC or other neighborhood council meetings? And we are talking about thousands of people. We are not talking about 10, 20, 40 or 500 or 700 people. They need to try better. They need to reach out to people. My daughter just only last week, she had 4 nosebleeds. And so a nosebleeds is the least of our concern and problems in the community. These nosebleeds is just a sign. It just reminds us, oh shit, we live in this neighborhood, and it keeps reminding us of what's going on. We have bigger problems. All of you who have daughters, let me tell you, I have daughter, and my daughter has friends in the community they went to school with. Most of them have fertility problems right now. They cannot get pregnant. They're very low egg counts. I mean, and your kids are even younger. I mean, my daughter moved here when she was 9 months old in the neighborhood. She has blood disorder. First they thought she had leukemia, but then they find out her factor 8 or factor 9 is messed up. Dr. Nadella knows what I'm talking about. She has von Willebrand. She has bleeding disorder that when she bleeds, it won't stop. It will not stop. I mean, these are serious stuff going on, and Department of Health is not answering any of our questions. They do not want to get the chemical list. Now they're talking about doing a health study, not human-based. I mean, this is ridiculous. This is an insult to us. I want to have a meeting. Please request a meeting that Department of Health just comes and answers questions. Just answer some of our questions. We have questions. We have every right to get answer to our questions, and then do this, whatever survey they want to do. 2 weeks, 3 weeks of delay is not going to hurt us. We have waited almost 6 years. And the way they're saying they're going to start health study 8 years after the blowout. What's 2 weeks? But we do want answers, please. Thank you.
Thank you, Helen. Matt Pacuco, please unmute yourself.
Can you hear me?
Loud and clear.
Hey, my name is Matt Pacuco, president and co-founder with Kyoko of Safe Porter Ranch. Yeah, really sorry to hear about your sister Lori. I mean, we've got way too much of that going around. How long it's been like 6 years. How long are we gonna like keep watching people in our community get sick and people even die while the health department and the company, all those involved and keep, forcing this stuff upon us? This has to go beyond the health department because clearly they're not listening. That seems like a waste of time to even try and get through to the health department. We have to go around them. Like Helen said, we were clear of that back in 2017, last decade, when we first started meeting with them, that they are not listening. Nothing has changed. Now that this has gone political with them tossing the ball back to, Barger and company, we need to go political, unfortunately. And maybe even go, well, not even maybe, we got to go legal. Because if the CAG involvement is part of the consent decree, then is that consent decree being violated? That's a freaking court order. And that was partially, LA city attorney was in on crafting that. So you as the PRNC, perhaps, well, not perhaps, I'm asking you guys to drag the LA city attorney's ass in here because they're part of the problem now. That's all I have to say. Thank you.
It's funny that you brought up the city attorney. He will be at the meeting in May, just FYI. But I want to, before I get Board's last comment, I want to ask Craig, he did such an amazing presentation this evening, to give us a final thought, and then I'm going to reach out to the board for their last comments and call it a night. Craig, are you still there?
I am, and listening very intently to everyone. And again, I see David Lasher's even joined. I am so impressed and very proud of the PRNC, who I am trying to represent well. All showed up for this special meeting and giving up your Monday night. Thank you very much. The community does need your help. The community does need you guys, the council, to have discussions, maybe have some uncomfortable conversations. But if you really, really want to stand up for the community, I honestly can't think of a better issue than this health study regarding the Aliso Canyon blowout. We're here for you. We're here to advise. We're here to give you any background that would be of use. We can share notes on what the written response should be on the goals and drafts. You guys have all seen me get upset and angry. But I will, yeah, I know, and my wife tells me to. But there's the Marys, there's the Loris, there's the Patties of CAG members who are always very level-headed and very calm and very thoughtful and deliberate about what they say. And when they get to a point of frustration that you just heard tonight, I hope that is further evidence for how far off path this has become. You know what? You can't go back. We should have started having these conversations 6 months ago, but it really manifested in the goals and priorities. So that's why we are here where we are. And I want to thank you guys again for making time for this discussion. Thank you.
Thank you, Craig. Appreciate that. I'm going to go ahead and get final comments from the board members. Jason Hector, would you like to lead us off?
Yeah. Thank you, David, for final comments. I think it's important to reflect upon what we heard today. The comment made by Lori, I want to stress as being very important. And the comment was regarding the people who've left the community, the people impacted with cancer and things like that. So I want to ask Craig Galante to make sure that part of what they're going to recommend as our representative, we rely on you, Craig, to decipher all the information and provide a recommendation. I mean, you're representing us, so that's what we ask. But I think that there needs to be a way to track people that have left the community. This is very important because many people I know sold their house, left the community, and they're gone. So how do we find those people? How do we get a hold of those people? And that is an important effort to undertake, especially if you're trying to do a health study. So I want to stress to you that point. The next point, I know there's kind of, a lot of people on the CAG, there's a lot of animosity, and rightfully so. But when we work with agencies and we work with government officials, it's important to have a good working relationship. So I've always stressed this as a board member, that it's important to have a good working relationship. So I just want to stress that, putting all those things aside, let's try and create a good working environment, not a hostile environment, and just bring, because if you're, I guess Becky made this comment, you get more, what is it? You get more more with honey than forget that the
More flies with honey than vinegar.
Yeah,
Yeah, vinegar. It's vinegar.
And so while I appreciate the CAG and your frustration, but I just feel as a neighborhood council that is the approach to take. And I don't support a no confidence, because I feel like we need to sit down at the table together, and we don't want to push away. The Department of Public Health holds all the cards. So they have the money, they have everything, right? They have the control, they have the money. Okay. So it's in the best interest, if you want to get to the end goal, it's in the best interest to bring everybody together and to be kind to one another and respectful. And I'm not saying that you aren't doing those things. I'm just saying, that's the way I feel, and that's just my opinion. But those are my 2 points. Thank you.
Thank you, Jason. Brandy, would you please unmute yourself?
Thank you. Again, so much thank you, not just to CAG, but also to all the community members who showed up tonight and spoke very passionately and very well about the issues, the many issues that we are facing with this. And, I'm here for this community. I'm part of this community. I'm happy to do whatever we need. And to Jason's point, it's true. We have to work well with people. But I think it's also important that we recognize that maintaining good relationships and working well with electeds doesn't mean rolling over on the things that matter to us. I'm, as many of you know, extremely politically involved. I have run against some of our electeds, and I have spoken out against some of our electeds, and I'm still friends with them. I still work with them and do so very well. You can stand up for the things you believe in and do so tactfully and respectfully. And I think it's perfectly fair for the community members who have expressed their anger, their frustration, and their sorrow, that I applaud them. They have done so for the most part without personal attacks or other non-tactful and not as effective means. So you guys keep doing what you're doing. I support what you're doing, and I'm one of you. And thank you, David, for having these meetings for us.
Thank you very much. Assad?
I guess speaking after Jason and Brandy, there isn't much I left to say, just that I echo exactly what both say, and especially I echo on what Jason said earlier. We need to have a one voice so that we have a letter of recommendations, requirements to get this going. Our health is in jeopardy. I'm not going to sit and whine, yes, I'm bleeding every morning and all that. But we, as elected neighborhood council members, been working very hard, and we continue to support the CAG. We support the DPH. We support any entity that can come in and help this community. I'll repeat what I usually say. We are the bridge. The neighborhood council is the bridge to bring in the stakeholders. with the solutions and to deliver whatever we can do for getting a health study, getting the Aliso Canyon shut down, getting alternative fuels, whatever it is. So at the end of the day, PRNC is here to serve the whole community and the CAG, and I'll leave it with that. Thank you, Craig. Thank you, Dr. Nordella. Thank you to the whole CAG members from all the NCs, and I thank all the NCs in the neighboring neighborhoods for standing by the Porter Ranch community. Thank you all.
Oh, this has been a pretty heavy night. We're going on 3.5 hours, and I think we've all taken a lot out of this. I think the DPH is taking a lot out of this meeting. I think the CAG is taking a lot out of this meeting. And I hope that everybody is able to really reflect on what we've learned tonight and consider some of the options that we're putting to the table on everybody's table. We really need to move forward, and we really have to do what's right for the community. So on that note, I'm going to thank everybody, and I wish everybody a good night. Thank you.
Thank you.
Good night, everybody.
Night, everybody.
Thank you. Have a nice evening. Okay.
Thank you.